Hello friends, if you're a caregiver of a home or bed-bound person, then this channel is for you. My name is Slava Kreynovich, I'm a nurse practitioner and I do house calls. Here I'm creating a community for caregivers where you can get your questions answered, share some ideas and tips of taking care of home or bed-bound loved one or a client, as well as addressing your personal, emotional and physical needs as a caregiver. Today, we're going to talk about home health agencies. I personally call them home health heroes. So, who is in the team? Registered nurses, physical therapists, occupational therapists, speech therapists, and home health aides. The specialists are coming about once or twice a week, depending on the order from your PCP, or if it's, for example, it's just physical therapist, then it might be the order from orthopedic doctor. When a nurse comes, she can help you with medication management in case you are not sure when and what to take these medications for, what to take it with. You might be skipping some medications and you're not aware of it. So she can go over your entire medication list with you and your PCP to ensure that the medications that you're taking are accurate. A nurse also can help with the injections if they've been ordered by your PCP and teach you about how to prevent wounds, how to prevent pressure ulcers, or take care of them, treat the wounds with necessary equipment that they bring in from the agency, as well as medications that are being prescribed by your primary care. Physical therapists are coming, and I call them your biggest cheerleaders because they will help you after the fall or a surgery or prolonged bed rest to get back on your feet, start moving better, stronger, safer, and with certain tricks and tips they can help you to move with less pain. Occupational therapists are coming to your house to teach you very detailed personal care routine in case you need to relearn how to brush your teeth, how to feed yourself, and basically over time develop self-confidence for your self-care. Speech therapists are very beneficial in case you had a stroke because with certain exercises that they will teach you, you will learn to swallow safely and speak more clearly. Home health aides are there for you daily. They will help you with bathing, other personal hygiene as needed, as well as cooking, cleaning your quarters, and grocery shopping if you're unable to do so yourself. So who in general is in need of home health agencies? This is great service if you come in home after prolonged admission to the hospital or rehab facility, if you after a surgery, or if you suffered a fall at home and you need help to get back on your feet, as well as if patient is bed-bound. A patient often might have problems with skin integrity and will need ongoing care of pressure ulcers and wound care. How to choose the right home health agency? It's very important because these people are coming to your house. So you want to make sure that these services provided by reliable people. Check if this agency is Medicare certified, if this agency is licensed by the state that you live in. I would also recommend you to look for the third-party reviewers like Google or Best Business Bureau to ensure that this agency has been around for a while. People are using it within your area, and look for words like reliable, compassionate, good communication. To avoid unpleasant financial surprises, I would recommend you to ensure that the services are covered, or at least you're aware of any costs from your pocket to ensure that you are not going to feel a victim of financial scam. Call the insurance company and check if they cover the services with these agencies. Then call the agency to make sure that they accept your insurance. Because one of the systems might not be getting updated in timely fashion, and you don't want to end up with the bill that you didn't count on in the first place. If you choose to pay privately for the services that they provide, make sure to ask for breakdown list of services to ensure that you are getting only services you need without any extras of something that you might benefit but you were not aware of, or you might not feel that you need it at this time. Also, when you choosing the agency and you're calling them to check what kind of services they provide, ask them if they have all the specialists available for this time being. Because if they do not have enough of nurses to cover the calls or enough of physical therapists to cover the calls, then you might end up with only partial service from this agency, because you will not be able, by the rules of coverage, you will not be able to obtain the services from a nurse from one agency and physical therapist from another agency. It has to be under the same umbrella. Ask the agency, how do they cover sick calls in case one of your nurses or your physical therapist getting sick or going on vacation? How soon they can get the replacement for them, because life happens. And at the end, let's talk about why these services are awesome. This is the care that comes to you, and you do not need to wait in the crowded clinics for physical therapist or wound clinic to take care of your wounds. You can get this service at home. When physical therapist comes, or a nurse, they always check your blood pressure, your pulse, and oxygenation to make sure that it's safe to start the exercises that they planned for you that day. If your blood pressure or your pulse are not within norm, they can spot the problem before it becomes a huge deal and eventually prevent your hospitalization. If you have any questions or additional tips and ideas about home health agencies, please put them in the links below under the comments so we all can benefit from your knowledge. And as always, I wish you and your loved ones strong health. And remember, joyful heart is the best medicine.